Hello, everyone, and welcome to the Asking the Tough Questions panel discussion today, a discussion on how to be a supportive LGBTQIA plus ally. My name is Jace Troy. I am the Diversity, Equity, Inclusion, and Program Assistant for NAMI New Hampshire, and I am here today with Michelle Watson, who is going to be helping me facilitate this wonderful panel of speakers today. But before we get started, I just wanted to lay a little bit of a foundation about the LGBTQIA plus community so that we are all on equal footing before we jump right into the panel discussion. So number one, I just want to put out there that respect is key. We are all human and we all make mistakes. So the focus of today is to make sure that we are helping each other learn and to grow as individuals and allies for the LGBTQIA plus community. And our ask for today is just that you keep an open mind as we go forward. And remember that any small step in the right direction is still progress. So although we are going to be sharing a lot of really good information today, if you can't remember every single piece of it, that is okay, as long as you are here and you keep an open mind and are able to start implementing at least a few things that you learned today. That is still a step in the right direction, and we are grateful for it. So why did we title this presentation Asking the Tough Questions? A lot of people have a hard time distinguishing what is an appropriate versus inappropriate question for someone in the LGBTQIA plus community. And we just wanted to offer this opportunity for people to ask those questions that they aren't sure about. Today, if you aren't sure whether a question is something that is appropriate to ask a queer person in the queer community, feel free to ask us. If the question doesn't end up being appropriate, and you probably shouldn't ask it to someone in your life or on a day-to-day basis, we will not just ignore the question. We will make sure that we take time to explain why that question may be inappropriate, or how to better phrase a question so that it doesn't, so that everyone in the conversation still feels comfortable. And Michelle?
And so I have experienced this a few times in the past couple of years, and Jace is so helpful to me, making me feel comfortable to ask him the questions. So we just want you all to know that it is okay, and this is a safe space, and we will help you through that journey. There are lots of things that, I'm still uncomfortable. I don't want to make that mistake, but because I don't want to offend somebody, but I have to get past that, and we're hoping today will help you get past that as well.
Perfect. Thank you so much. So just to start off this presentation, we just want to identify the difference between gender and sexuality. One way that I like to explain this to people is that gender is who you go to bed as, and sexuality is who you go to bed with. So that is to say that gender is your identity, and it may or may not align with your sex or the sex you were assigned at birth. And it may look very similar to how you express yourself. So your expression is how you present yourself to the world. So your gender may be very closely tied to that expression, but sexuality has more to do with attraction. So who you are attracted to physically, romantically, that all falls under sexuality. And to get a little more in depth with this, I may not spend a lot of time on this slide, but I will be putting resources in the chat as we go to all of the things that we mentioned along the way, so that you can look at them later on when you have more time. Oftentimes we say that gender and sexuality are a spectrum. So that means that they aren't necessarily something that is super rigid. They are fluid, and for some people, they may change often. They may range, but for other people, it may be more cut and dry. So I like to start here at sex assigned at birth. For someone who may be assigned female at birth, they may identify very strongly as a woman, which would be this end of the spectrum, or they may not identify as a woman very much at all. And they could be down here. They could identify more towards manness, as it says on this end of the spectrum. And with that, their expression, how they show themselves to the world, may be a more masculine presentation. But just because someone identifies one way doesn't mean that their gender expression is necessarily going to line up 100% of the time. Someone who identifies as a man, maybe they were born male, they identify as a man, but they don't express themselves very masculinely. They may express themselves very femininely, and vice versa. So just because someone's gender expression is one way doesn't mean that it is necessarily the same as their gender identity. And the only way to really know what someone's gender identity is to ask them. And oftentimes we do that by asking, what are your pronouns? I always say, what are your pronouns? I don't necessarily say, what are your preferred pronouns? Because although that has become the norm for a lot of people, by throwing in the word preferred there, it almost makes it seem like our identity is a choice. And although it is something that lives up here in our brain, it's not necessarily a choice. And so I always just say, what are your pronouns? Because that is a really simple way to get to the point without making someone feel like it's something that they chose or is a burden to other people. Anatomical sex also has a lot to do with sex assigned at birth, but also goes a little bit more into someone's gender identity. For me, I am a transgender male, and I'll use myself as an example for this section here. When I was born, the doctor said, it's a girl, and they were wrong. But when they said that, that's because my anatomical sex lined up with female anatomy. So when they saw me, I was somewhere over here on this scale, on the female scale, and on the male scale, I was down here. But when I realized I was transgender, I ended up doing hormone replacement therapy. So I started taking testosterone. So on this scale here, I started sliding back more this way. And on this scale, I started sliding more this way. And then when I got gender affirming surgery, I felt like I had slid even further down this way, and I had continued to slide more this way. So that is what we mean when we say all of these are something that's fluid, okay? We are not stuck on one point on this line from birth, and based on figuring out our identity and our sexuality, our attraction, and our expression, what we do with that. All of these things may change at one point or another. And that goes with sexual attraction and romantic attraction as well. Okay, I know that was a lot, but I will make sure to throw these resources in the chat once I am done, so that you can look at them in the future when you have more time. And last but not least, everyone's experience is extremely unique and personal to them. Today, we will be sharing our personal and professional perspectives on the matter. And because everyone's experience is unique to them, what works for one of us may not necessarily be a solution for one of you, but we are hoping that through this discussion, we will give you the tools that you need to be able to navigate either the LGBTQIA experience or being an ally to the queer community as well. So just remember today to keep an open mind as we go forward and to always practice compassion and listening. When it comes to listening, I always say listen to understand, not to respond. A lot of times we take in information while already thinking about the next thing that we want to say. but a lot of these experiences may not be something that we have a response to right away. So make sure that we are listening to really understand what the person is saying so that when we do eventually have a moment to respond, we can respond with integrity. Okay. And with that being said, I'm going to turn things over to Michelle and I'm going to stop sharing. There we go. And she can help introduce our panelists.
Great. Thanks, Jace. And thanks for all of that information. I learn something every time I have a conversation with you. So just a quick couple of things that I want to mention. Today is about all of you asking the questions that you have, and you can either put them in the chat or you can put it in the Q&A. Both Jace and I will be looking over that to make sure that we get your questions answered. And for those of you that put them in during your registration, we will address those as well. But first, so let me introduce myself. My name is Michelle Watson, and I work here at NAMI New Hampshire. I'm the Volunteer Engagement Program Supervisor. So if you're looking to volunteer in the future, I will be your contact. But now the most important part is for us to hear from our panelists. And our panelists are going to introduce themselves. They're going to share their name, their pronoun, why they wanted to be part of this panel, and one important thing that they think allies should know. So Susan, let's start with you.
Hi, everyone. Thank you so much for attending. My name is Susan Ward. My pronouns are she, her, hers. I'm with NAMI New Hampshire. In my personal life, I'm a co-facilitator for the Seacoast PFLAG chapter. PFLAG is a national organization, and it's dedicated to educating and advocating for our LGBTQIA community and their families. I'm also a PFLAG board member and ally. I have a background in education. I also have a background in mental health. And one important thing an ally should know is that you can help be the voice of change, and your advocacy and education to those that might be uninformed or not uneducated about this subject can really help kind of foster and empower that change.
Great, thank you so much. Robin.
Thanks so much. My name is Robin Nafshi. My pronouns are she, her, hers. Next week, my wife and I will celebrate our 20th anniversary. We have been together 22 years. We have an 8.5-year-old. I wanted to be on the panel because I wanted to reinforce the idea that there are so many different perspectives and different experiences. And one thing I want you to know, which might seem like this is an odd thing for me to share, but the recent Supreme Court case overruling Roe v. Wade, the Dobbs case, is one that is of tremendous importance to the LGBTQIA community, and the degree of outrage that is felt in our community, I'd say, is comparable to that of many across the country. One reason is, and this really goes back in many ways to the 70s, but I think that what was then really just the gay community or the lesbian and gay community has always felt that our fates have been intricately connected to the fate of women, and that so much of our culture is about control, who gets to control whom, and what are considered to be appropriate ways to act and look. And so women controlling their own bodies is often considered to be something outrageous. Why would we allow women to do that? In much the same ways that LGBTQIA folks seek to control our own destinies. And secondly, that we know that just as the decision was coming out, that Justice Thomas has talked about other cases that he would like to revisit. And Obergefell versus Hodges is one of them. And that was the one that made same-sex marriage legal across the country. Be aware that one of the other ones he's interested in reviewing is Griswold versus Connecticut, which allows married couples to practice birth control. Sorry to be political, but I just wanted to share that link for people.
Great, thank you. Didn't know if you wanted to share your profession as well?
Oh, I'm also the rabbi of Temple Beth Jacob in Concord, New Hampshire, and that's our sanctuary.
Great, thank you so much. Jessica.
Hi, everybody. My name is Jessica Goff. My pronouns are she, hers, and I am the coordinator of community programming and engagement over at Seacoast Outright. And our mission is to support and advocate for LGBTQ+ youth in the Seacoast and beyond. I thought it was really important to be here today just because we know from experience that these conversations are so important. And I'm happy to be part of the conversation. And I think that one important thing for allies to know, I think the statistic that's hit me the hardest is that when youth have one supportive adult in their life, it reduces suicide risk by 40% for LGBTQ+ youth. And so what's important there is it doesn't have to be a parent, it can be a teacher, it can be a loved one, it can be an adult family member, and that we all have the potential to be that adult in a youth's life. So I think that that's really important to remember, but happy to be here.
Thank you. And it is so important for us to remember that we can make a difference, every single one of us. Kathy.
Hi, my name's Kathy Bean. I'm a parent of a transgender son who is now a young adult, thriving. He's in college and doing really well. And my pronouns are she and her. I was invited to the panel by Jace, and who can say no to Jace? And also with my son's blessing. I'm going to try not to get too personal about his experiences because I feel like that's his story to share. But I've been on this journey for 7 or 8 years, and I thought it was important to let allies know that besides the support for people in this community, it's really important that allies get support too, that there's tons of resources to help them learn. Like both you and Jay said, Michelle, that, you know, there's a lot of mistakes, there's a lot of learning, and it's okay. And we just need to be kind of, you know, kind to ourselves, but help get the resources so that we can help those people.
Thank you. We're so happy to have you here.
Thanks.
Bobby, you're next.
Hi, everybody. My name is Bobby Kelly. I'm a family physician over in the seacoast of New Hampshire. My pronouns are he, him, and his. I wanted to be part of the panel because I like meeting other people. I also like talking on this topic, both from a personal perspective, as we heard from Robin. I too am celebrating an anniversary. Just yesterday was our 14-year anniversary on Stonewall, which if you're not familiar with Stonewall riots, please Google Stonewall and learn a little bit about the LGBTQIA history. But we have 2 children. I have a 10-year-old daughter as well as a 6-year-old daughter. And I always enjoy being able to share my perspective as an out cisgender gay male in New Hampshire, as well as sharing the lens of a clinical provider. So I do provide a significant amount of clinical care to LGBTQIA folks here in New Hampshire. I'm the clinical director of our LGBTQ health program at CORE in Exeter. And I'm happy to answer any questions that come up, like I said, both personally and professionally. And then there's so many great things that have been shared. Let's see, one important thing I think allies should know, and this is something that Jace hit on earlier, but things are not one size fits all, and that can be applied to really any population. But in particular, my experience with working with the LGBTQI folks here is, you know, there's no one size fits all answer or approach or path to clinical care, path to somebody's journey in life, really. And what I think is helpful to do is to try to be open-minded, honest, authentic, and kind in how we interact with each other about these topics. So thanks.
Thank you. Thank you for sharing. And Emmett, last but not least.
Thank you. Yeah, my name's Emmett LeBlanc. My pronouns are he, him, and I'm the program manager for the Transgender Health Clinic at Dartmouth Health. And I'm excited to be part of this panel because I love talking about these these conversations, engaging in, discussion regarding gender affirming care and resources for the LGBT community. I'm a queer transgender man myself, so I was assigned female at birth, and I never really quite had the language to understand who I was, deep on the inside, and how to reflect that on the outside to feel happy and fulfilled. And so once I, got that language, I was able to use that language, identify with it, and also seek care as a result of being able to find that language. So I find that it is super important to have conversations, because even though I grew up in this weird age where I still remember dial-up, but also had access to like cell phones and internet, like in my pocket, right? Kind of in this weird realm of both, right? But now I have, there's so much access to information out there. So I think the biggest takeaway is like, I know the language now, but I didn't always. Like, I was not born with this information. I was not born knowing how to navigate this space. And so I say that because it's going to be hard and it's going to be uncomfortable. And you're going to be looking at concepts and ideas that are like breaking down a lot of binary concepts that we've just always been kind of born into. And that's okay. And that's okay. And it's going to be a constant teaching process. And I would just, just say to be open and be tender, and also hold yourself accountable, so that you can support your friends and loved ones and colleagues and whoever else in your community. So.
Thank you. And thank you all for being here today. And, we worked hard. I said, well, mostly Jace, worked really hard at pulling together this, diverse population of panelists with different backgrounds and coming to speak to us from all different aspects of this, so that hopefully we can help everybody who's here participating today as attendees to answer the questions and, get through these tough questions as we all learn and to improve ourselves. So I'm going to start with one question, and this one is for Emmett. What are some ways we can make our language more inclusive?
Yeah, it kind of bounces off of what I was talking about just a moment ago. But with language, I feel like it's just about, so like we've always been, like, at least in our kind of Western culture, we have a society of this binary, right? This idea of like man and woman, boy and girl, pink and blue, sir and ma'am, right? And so something I've tried to do, even when I'm just generally talking about people, is trying to take that gendered language out. So I don't say, hey guys, say, hey folks. And like I say it in emails all the time. So if I have like 5 folks in an email, I'll have to go through and try to find another word. But I try to find things that aren't gendered. And I find that when I'm doing that, even if like other people don't realize it, when there's a queer person in the room that doesn't identify within the binary, they see it and they feel seen when that happens. And so when it comes to language, just finding ways to be more inclusive. And when it comes to being like a medical provider, especially when it comes to like anatomy and language regarding the body, asking your patient what language do they use is going to be like the most appropriate way to approach things like going through a physical exam or talking about anything that's going to happen with the physical body. Making sure you're using language that is affirming for the person. And it's the same thing if you're like talking to your kid who's just come out. Maybe there's terms that they don't like using for their body. So having that conversation with your kid and ask them what feels comfortable for you, and just having that open conversation without judgment, right? Just doing it because you love and care about them, and not from like a curiosity standpoint, but just from like a standpoint of wanting to engage in like a wholesome conversation.
That's great, that open conversation and non-judgmental. And I was recently oh, sorry, go ahead.
Oh, no, go ahead.
I was recently talking to a physician who had said that in his practice, they recently added the pronouns on the form, and what a difference it made to him in providing and asking the right questions of his patients as they came in the office. And he was surprised, I guess, at how it changed his approach. and just that little bit of information and how he felt like he was connecting much better with his patients, and how that could change that language that he used with them.
Yeah,
So it's really important.
Yeah, and I would just say the last piece would be if there's like a term that you don't know, it's amazing how much is on the internet and how you can find it. And so I would just say like looking it up online is way better than like asking somebody in the queer community to like give them this whole big spiel about what that term means. I think that if there's like, you know, if you're in a patient situation and you're asking your patient, well, how do you identify? They can totally explain that and kind of, you know, share their story a little bit so that the provider has context. But generally, like if there's a term like you just hear in the news and you're curious about what that means, going to like your one queer friend or one trans friend or whatever it be, it's putting pressure on them to educate you when Google's readily available. So I would just say like using like that autonomy to seek the answers is like the best way to be an ally.
Great, good point. Thank you.
Mhm.
Jace, did you want to chime in on something? Or you're all set?
I'm all set.
Okay, you just
Thank
came
you.
back on screen. I wasn't sure. Robin, this next question is for you. Why is it important to educate ourselves about LGBTQIA issues instead of just asking our loved ones? And Emmett just kind of addressed that, but let's take your view on it. You're muted.
Of course. Emmett, you just fed it right to me. And before I answer that, I also want to, if I can, add one thing to Emmett's remarks, which is, I think in the lesbian and gay community in particular, language is also about the assumption of, if we are married, the assumption always that our spouses of the opposite gender, sex, whatever. That is also, like I've seen on medical forms also now, where doctors will not only ask that, but ask if you're married and ask specifically how your spouse may identify, or which is really obviously an important part of language as well. So yes, Emmett, I agree with you completely that the burden should not be on those of us who are part of the LGBTQIA community to do the education. And I think we've learned a lot from the African American community on especially race dialogue and racism issues about do not expect your, your Black friends, your Asian friends, your Hispanic friends to be the ones to educate you on it. First and foremost, you get only a very limited perspective if you rely on asking your one queer friend, or maybe you have 2 or 3 and you ask them. It still is a very limited perspective, and especially if it is for a loved one. You know, let's say you've just a child, a niece or nephew, which becomes language challenge right there. But somebody in your very close to you in your family is come out, and you know, your loved ones, if you go to your loved ones to ask these questions, they might not be completely open and honest with you. They may not want to share things out of fear or shame, or even shock. We know, as Jessica mentioned earlier, that the rate of attempted suicide, attempting of taking one's life, is very, very high in the young folks in the LGBTQIA community, and they may not want to shock you with that and let you know that suicidal ideation or even an attempt was a part of their past. You've also nibbling. Thank you for the adorable neutral term. Thank you, Jessica. It is also possible that, you know, you as the questioner have made mistakes in the past. We all have. You know, I think Jace showed on one of the slides, none of us is perfect, right? And I may have been hurt by something you've done in the past, and we don't need to bring that up. We don't need to bring up the past necessarily, unless I want an apology, but still, don't make that risk. Similarly, the conversation can go in a number of different directions and places. And let's imagine that you express a level of ignorance that is uncomfortable for me. Bobby suggested before that if you didn't know what the Stonewall riots were, for example, to go and look them up. I may be very deeply hurt by your lack of knowledge. It may feel to me like a lack of interest. or just a lack of concern. And so don't put your relationship into that vulnerability. And finally, things in my past may be traumatizing to me. And so don't ask me to relive points of pain or fear, or even outrage, and things like that. So it's much better, again, to use go online and start seeking information from more anonymous sources, reliable, of course, but more not necessarily from the loved one in front of you.
Great, thank you for that. So the next question, we're actually going to have many people respond to it, because this is why we're all here today, right? How do you support LGBTQIA individuals as a provider, as a parent, a community leader, etc.? So let's start with Kathy.
Hi. Okay, so my experience is with my transgender son, for the most part, and trying to support him. I think first and foremost, it was, reassuring him many times, I love you, I support you. I don't know what I'm talking about half the time. I'm learning. I will admit that I did ask a lot of questions of him and asked him to educate me. He didn't seem to mind most of the time, but that was kind of the safe space. I don't think I would do that with anyone else. And a lot of it was, he was a minor when he came out. So a lot of it was running kind of navigation and roadblocks for, finding him support, finding medical providers that were willing and understanding to help him. Years ago, it's much easier now. A little plug for Dartmouth Hitchcock. They were amazing in helping us, and we never, no one ever blinked an eye at us when we came in. It was a wonderful experience, and so that was helpful. Explaining to other people, because at the time my son was, anxious, a little insecure about this stuff, is pretty normal. So for me to kind of speak up for him and explain to people, what his journey is, that, okay, he no longer goes by that name or those pronouns, and kind of taking the heat off of him, as a minor. As an adult, he's pretty capable of doing all that himself. I've learned a lot from him. He's strong and brave. But I think that, the number of mistakes you make, just continually telling them, look, I'm learning, I'm trying my hardest. I may mess up your pronouns. I've been saying this name and these pronouns for how many years? It's kind of autopilot. So, just know I'm trying my best. Please correct me, help me along. But I think if they know that you are supporting them and you care and you'll do anything, that's really goes a long way.
Thank you, Kathy. And there was a question that actually had come in on the registration form that you touched on. So I just want to follow up with that with you right now. And the attendee asked, how do you go about sharing from your perspective with other people that this transition for your child? Like, how do you explain it to people? How do you broach that subject?
Oh, yeah. So I think it depended on the audience. It was immediate family, face to face, this is what's going on. It wasn't just one conversation, it was many conversations. Things like the school, that was me, again, because he was a minor, that was me being the one out front, saying, this is what's going on, this is the way it is. There were instances of, you have friends and acquaintances that run the gamut, close friends, we talked about it, acquaintances that you're at the checkout line at Market Basket and they're asking how your daughter is. usually those times I would just be like, oh, everything's fine. The family's great. And because it's not an appropriate place to have this discussion with everyone else, you know, listening, and you have no idea how people are going to react. I will say there were we had an extended family party at one point right after my son came out. And I sent an email out and explained the situation because it was a large group of like 60 people. And that kind of, you know, in one way I felt like I chickened out by not telling them face to face or on the phone or whatever, but it also gave them all a moment of time just to kind of settle their thoughts, you know, absorb this and think about how they're going to react so that they don't come to our house and react in an inappropriate way. So it's just showing a little grace to them. So I guess it depends on the audience. And it wasn't easy. We do have, you know, people in our extended family that we weren't sure they were going to be receptive to this. That was difficult. Luckily, it turns out most of them were. And then the ones that weren't, that's on them.
Great. Thank you so much for sharing that. That's really, really helpful. Susan, so, you know, back to the question of how do you support individuals from your perspective?
Thanks for asking. I thought about this. I was thinking about how to support individuals like as somebody in the community. And then I thought about how many different aspects that entails in terms of an individual in the community, maybe somebody as a business owner in the community, maybe someone as a support system in the community. And a few things that I thought were really important is to just listen. And I know Kathy mentioned that before. Listen and ask questions and ask how each person needs to be supported. I think it's very important to speak out against any LGBTQIA harassment or discrimination in my community. Attend LGBTQIA events such as Pride and learn more about and discuss LGBTQIA issues. If you're a business or some kind of support in the community, making sure that your messaging is LGBTQIA friendly. And whether that's messaging that you're writing, advertising, or just having a conversation. And again, we've talked about sometimes we make mistakes or we might not have the language yet, and that's okay, but we can take that time to learn. And then I think about myself in terms of being a facilitator, co-facilitator in PFLAG in my community and how I can support and hold monthly meetings for families or anybody in that community where I can just help be a support system, offer them time, be a listener, affirm feelings, and provide that support and opportunity for them to share and ask questions. And just like today, a really safe space to learn from each other.
Great. Thank you so much for your perspective. Jess, let's hear from you.
Yes, absolutely. So like Susan, I feel like there's a number of places you can go with this question. And I love all of the suggestions so far. So a few that I just wanted to touch on were really how to make a safe space for everybody. So people may not feel comfortable telling you their pronouns. So I think a great strategy is to tell people your pronouns. I think as you get comfortable asking people, that's great. But even saying, hi, my name is Jessica, I use she, her pronouns, opens the door for other people to know that you're a safe person to tell, to wear pronoun pins, to in your office have a little, or on your lanyard, wherever you can have a little symbol to say, I'm an ally, or to have a rainbow, or something that really just creates safe spaces for everyone to know that you're a safe person to tell, because people don't always know. It can't really be assumed in most situations. I think the other thing is, especially in my role, I've met a lot of kids, and I think that the biggest thing is when kids tell you who they are, trust them. You don't know their experience. They know their experience better than anybody else. And you don't need to fully understand what they're saying to respect it. You don't need to fully understand the nitty-gritty of each identity, just respect what they tell you, right? And for a lot of parents will say, but what if it changes? Okay, right? That's fine, right? My kid wants to be he today and she tomorrow. Okay, right? So when you wake up in the morning, you say, hi, what are your pronouns today? And you go with it. And that's okay, because at the end of the day, even if your kid goes, you know what, never mind, which happens in a small minority of cases, the kid will know that you will love them and support them no matter what. And that is of benefit to everybody. And I think the last thing I wanted to say was legislative advocacy. There have been a lot of scary attacks in our country and in our state specifically. So if you can, to get out there and to advocate. They attempted a repeal on conversion therapy in Hampshire this year, which was just passed a few years ago. There was a bill that was going to force teachers to out students or to face liability. And so these bills are being seen every year, bills that seek to make trans affirming care for youth child abuse. And these are scary, scary things. So if you can get out and advocate, do that, because that makes a huge difference, as well as the things that you can do day to day.
That's great. Thank you. And I'm going to come back to you about the policy change in a few minutes. But first, I'm going to give Bobby a chance to also talk about, how to be supportive.
Sure. Thanks, Michelle. This panel, it is quite impressive group of people to be talking with. I feel like there's not much left to say, but I'll try to provide, some advice or words of wisdom in regards to a provider. So many of the people have already mentioned, the importance of using inclusive and supportive language. Also acknowledging, I think, something to think about is most people aren't thrilled to go to the doctor's office or clinical, provider's office anyway in the first place. And then if you overlay on top of that somebody who is in the LGBTQI community who may have had, one or multiple really negative experiences in healthcare, it just sort of overlays that significantly. And I've seen it happen repeatedly where, a person's blood pressure and heart rate is through the roof when they come in after we talk, and sort of I am able to help create a space that is a bit more comfortable for that person. Vital signs return to normal, and it's a really good space. Not always the case, but oftentimes. I think it's also really important for folks as a provider, for better or for worse, we're often seen as a respected position, in a position of either power or at least authority in some ways. And so in that setting, I think it's important for us to be able to advocate for change as appropriate, either within our setting in the clinic or the hospital or the practice. Things we heard already of intake forms being adjusted to include things like pronouns. There's a whole heck of a lot of ways that forms can be improved, sometimes limited by electronic medical record, but not always. Identify, what did I put here? I was taking all notes. So identify and correct any either inappropriate or unsupportive language that you see in the practice, right? So it's important to speak out when you see things that are inappropriate, and especially as a provider or a doc or whoever you may be in your office space that has, really, I encourage anybody to do it, but oftentimes if somebody, such as a provider speaks out, it often carries weight with it. I think also we talked about wearing rainbow pins, pronoun pins, etc. And the one final thing about to all providers would be, if you're clinically faced with something that is new to you, the patient's coming to you with a question about either themselves or treatment that they're interested in, or a clinical concern that you're maybe not that familiar with already, rather than immediately and reflexively referring to somebody right away and saying, oh, I can't do that, you need to see somebody else for that. I've heard time and time again from patients that folks generally really appreciate a provider being honest with the patient that, hey, I haven't really seen too much of this, or I don't have a lot of experience with this, but give me a couple days and I'm going to do some reading up on this and get back to you, because you know what, the patient's not the provider and they shouldn't have to be able to, or be required, I think, personally speaking, to manage their care and answer all the questions that come up. And sure, if ultimately you're not able to, you feel like you're able to appropriately handle whatever it is that clinically is coming your way, perhaps we can refer, but also acknowledging that referrals, especially for specialties, mental health, providers, psychiatrists, et cetera, right now are severely backlogged. And so for a very, potentially vulnerable person, coming to you with a particularly vulnerable concern or question, to say, oh, I can't do this, I'm going to refer you to somebody who can see you in 4 months, 6 months, is probably not in the best interest of the patient. So that's all I have. I know that we have a lot more questions. So I also just wanted to acknowledge there was a couple things in the Q&A that I think a few of us have been answering. I've actually never seen that function. It's very slick. Hopefully that was okay that we answered them off, in a parallel conversation. And if folks have any other follow-ups to that, we can get to it maybe at the end.
That's great. And we may go back and read through some of those too as well. But I noticed that you guys were answering them, and I appreciate that. So, but I did want to talk quickly, or just acknowledge what you said about, providers being upfront and honest. And I think, it goes across the board when you're working with a provider, for them to say, I don't have all the answers. I think they become much more trustworthy. And especially in this situation, right? You don't want somebody making things up. And, if they, I think anytime that we can make that transition for somebody, instead of saying you have to go, I can't help you, you have to go find somebody else. If they can actually make that handoff for you, it just, that personal level really makes such a big difference. So thank you for all of that. And you did find plenty of additional things to share. So Jess, I just kind of wanted to go back to the policy part that you were touching on, because we did have a question that came in about what is the best way to ask LGBTQIA folks to share their stories and to encourage policy change given today's political climate. How do we support them so that they can step up? Because they're big, it's such a vulnerable place. So how do we support them?
I think that's a great question, and I don't have all of the answers. I think that's something that we've been working to navigate as well, because those personal stories are so critical in getting these bills defeated. But it's also not fair to ask folks to share vulnerable information about themselves in a hearing where other people are saying horrible, nasty, untrue things about trans people or non-binary people or whatever the bill is going against. And so it's really making sure that people have an understanding of what they're getting themselves into, and being able to support them through that process, especially youth, making sure that youth have good support networks and that you're not throwing someone into something that they don't know what to expect and then are vulnerable after, especially hearing what other folks are saying in the room. So really making sure you're also not leaning on one person too much. If you can get a broad scope of people who are able to testify, or even if folks are willing to write letters, really do whatever that they feel comfortable and safe doing, is huge.
Great, thank you. I was going to say, is anybody else? Go ahead, Robin.
As one of the faith leaders in Concord, I have discovered how easy it is. So I'm going to take a backup from where Jessica was about getting people to testify and all. I think a lot of people in the state of New Hampshire are not aware of how easy it is to actually testify in a bill. There are public hearings. There is a requirement that there be public hearings on every single piece of legislation that is introduced in this state. And literally, you can walk into the legislative office building or wherever else the hearing is taking place. You figure out what room it's in. You go in and there's a sign-up sheet, and you put your name down, and it'll ask whether you're pro or con, and if you want to speak. You can indicate that you're just there to show support, pro or con, or you can indicate that you want to speak. And that list is then given to the chair of the committee, and they basically don't leave that room until every single person who indicated that they wanted to speak has had a chance to speak. It's that simple. It really is. I mean, I joked ever since I've lived here for 12 years that the state sport of New Hampshire is politics, which, with a 400 representative legislature, it clearly is. And so for those who are comfortable, or for our allies who are really wanting to be, I'm gonna look right at you, Kathy, and say, like, being a mama bear, right? Like, you don't go after my kid, and you're willing to take that step and go in. It is a really simple and very accessible opportunity for people.
Great. And something that Kathy shared which I think is important in those situations, right? Kathy said she had permission from her son to be here. And that's important, especially when we're testifying. And here at NAMI New Hampshire, when we do our advocacy training, that is one thing we always talk about. You know, if you're going to be revealing something about a loved one, make sure you've got their permission. Go ahead, Kathy.
Yeah, I just wanted to add to that. I have not testified in person, but even just writing letters has been effective. I've seen change, you know, on a very local level, just by, you know, writing letters or emails, requesting everyone I know in that space to send letters or emails of support as well. And it has, you know, changed a few things. So, so my next step is to testify. I'll work on that, Robin.
We can help you with that. We do training for that.
Oh, goodness. Okay.
And so kind of along that similar line is one of the questions that had come in was somebody who's as a CASA guardian ad litem, how can they best represent the voice of a youth in court? So I don't know if anybody wants to touch on that more specifically. You know, my interpretation would be that, just as we were saying for Kathy, that she needs to get permission, is you just be careful about the story and how much that youth wants revealed. And because they have to live with anything that comes out of that. So I think include them in this conversation, just like we've been talking about including everybody. Go ahead.
I think there's also the possibility of asking the court to make sure that it be some kind of like a closed hearing, and that the record remain somewhat, you know, sealed or closed, because I think they will often do that with minors. I don't know I mean, there's actually a member of my congregation who does act as a guardian ad litem, but I don't know the process itself. And if it is, and I think that's one of the things you want to do is look into how confidential you can keep it.
And so I've seen, you know, comments coming through about will these resources be shared besides just in the chat? And we are going to send a follow-up email. And so maybe we can get more information on that and include that in that email so that we're answering it appropriately. Jace, is there anything, I know we have a few comments and questions in here. Is there anyone that you want addressed first?
There was one question in the Q&A that says, if we think a kid is LGBTQ+, how do we ask, or do we even ask? Do we let the kid tell us when they are ready? I never want to assume, but want to give permission for a kid to come out. And it looks like Rabbi Robin had raised her hand to answer that. So if you still would like to give it the first go, it's all you.
You know, I think it's a, you got to know the kid, and you've got to know how do you normally communicate with this child? Let's assume it is your own child. I mean, how do you normally communicate? I mean, are these kinds, do you have a very open relationship where you share a lot of things with each other? Under those circumstances, you're probably okay asking, especially couching it in language about safety, and this is, you know, how much I love you. And, you know, Kathy shared all of those wonderful things that she said to her son. Other times, you know, I think about my own life. I'm 61 years old. I came out to myself when I was 9. So this has been a very long identity for me. My mother out and out asked me when I was about 16 or 17, which was not a good strategy, let me just say. On the other hand, a cousin with whom I was extremely close told me about a Broadway show she had seen, which the show is called Bent, and it's actually about 2 gay men who were taken into a concentration camp during the Holocaust. One of whom is Jewish, one who is not. They were a couple. And so my cousin just sort of told me that she had gone to see this show, and it was really, really, you know, deep and striking and all of this, and had I heard of it and what did I think of it, and kind of just opened the door for that kind of a conversation. And so I think those are two very different strategies, but I think either one could work. Another one is just to sit back and know that keep creating a loving home, a loving relationship, and when that child's ready, they'll tell you. You hope, but you just know that, just kind of creating that environment, I think, is what we do best and what we can do best for them.
Thank you, Robin. There's in the chat a question. I ran into a situation that was new to me recently. I have read that a significant percent of young children under 10 that initially identify themselves as trans later identify as gay. This confusion makes sense to me as a young child's understanding of sexuality is usually very limited. As a parent, caregiver or /caregiver, how do you affirm a young child that initially self-identifies as trans or gay, knowing that they may change their own identification later? Go ahead, Susan.
I wouldn't mind answering that. I think, and I think Jessica had touched on this a little bit before, just in a couple of sentences, but I think the most important thing you can do is listen. Really just listen, be patient. Our young people may not have the language to express what they're experiencing or express what they're feeling, and they might also still be figuring it all out. And just affirming their feelings, telling you that you love them, reassuring them, supporting them as they're working through their own processing is really going to be helpful. And then they know that they can come to you. They know that they are loved by their parent or caregiver. It improves confidence, self-esteem, better mental health. It helps decrease suicidal ideation as well. And even possible substance use in the future as they begin to grow because they know they're supported. It might include you learning new languages and new language and terms. And it's a great way to just start having conversations, maybe challenging conversations even. It's a great way to make mistakes because we learn from them, and that's okay. And to own it, apologize, and then just continue to do that work. And remember that it's a journey and it's moving forward together at its own pace. So
that's great. Thank you. Bobby, you had your hand raised.
Sure. I was just going to add on to what Susan was saying is I think for some people, like the person who made the comment, it might be helpful to hear that generally speaking, in the medical world and with the guidelines that most of us follow, medical treatment or medications in terms of gender affirming hormone treatment, whether it's either puberty blockers or gender affirming hormone medications, often needs to either happen for GnRH blockers, which is the puberty blockers. We usually wait until at least Tanner stage 2, which I'm not going to get into the details, but it's not like, a 6-year-old comes and says they feel or think that they are trans. Medication isn't going to automatically be prescribed. And then in terms of testosterone, estrogen, and other medications for that route, we tend to have other medical reasons to potentially delay treatment. So again, that's a very vague way of answering the concern that I think that some people, maybe even parents, feel, oh my gosh, if my child identifies with or believes that they are trans, and it may be a difficult concept for them to understand, and that may be what the parent's perspective is. I think approaching it the way that Susan was mentioning, which is with support, right? You're not going to hurt somebody with support, and that most medical providers aren't going to throw medications at a person, especially if not everybody in the situation is on board. So I think that I just wanted to reiterate that because people tend to have that and use that. I don't think the commenter was using that as a fear tactic, but I've heard that used before, and I don't want that to be misunderstood by people.
Great, thank you for sharing that. I think we have time for one more question, and I think I'm going to direct this to Emmett. and this was in the Q&A, any suggestions on how to support trans teen with advocating for themselves? This may be more of a motivation issue, very unmotivated teen, but they have now changed their name legally, but still won't tell many family members. I've offered support in helping tell people, but still won't.
Yeah, it can be difficult. I don't know if I have a perfect answer necessarily in terms of telling family. I made a Facebook post and I told I told my mom, I told what else I told my advisor in college, right? I told a few handful of people like in person, but then for everyone else, I just changed my name on Facebook to Emmett, and I made a post, and that was kind of really it. And then for extended family, they might have had some questions. I'd have people reach out and message me some things that were not the most appropriate, just because like lack of knowledge, lack of education. And I think that's like a big fear. Like my aunt asked me why I couldn't just be a lesbian when I came out as a trans man. And so like her concept of gender and sexuality and just like understanding of all that was just not on point with where I was at and where I'm at in my journey. So it's just taken some time, but because of those comments, it made me nervous to share my journey with people. So, and then like going to like family events, like this past Christmas, my uncle was loading the dishwasher and he said my dead name, which is not my name. It's not a name I use, but it's the name that my mom gave to me at birth, right? It was an uncomfortable thing, but he corrected himself, he moved on, and then we just went on with our evening, and it wasn't like this big whole thing that disrupted the evening. But early on in someone's journey, that can be disastrous, and it can lead to tears, and it can lead to frustration. And so as a parent or a guardian or like a sibling or whoever, is like so within your power to correct other people when they're misgendering your child or your sibling or whoever it is, and just affirm them, constantly be affirming them for who they are, and let them know that you support them. And I think it was Jessica that made that statistic about having one supporter really makes a huge difference for these kids. And these kids eventually become adults who are actively engaging and what we're trying to do here. So yeah, I would say in terms of that, supporting them is going to be the biggest thing you can do. But I don't have a perfect answer for how to come out to people. And I think that's been touched upon by different people, because it's going to depend on the context and like what your relationship is with them, and even just like how they feel. Like, I don't know, my family in particular is pretty liberal overall, but some people don't have that experience. Some people have very like conservative leaning families or very religious families, or, so that dynamic is going to look different than what my dynamic has looked like.
Thank you so much. And we are out of time, but I want to give everybody a chance if there's one final quick sentence they want to add, to share, to give you each time to do that real quick. So I'm just going to go based on my squares. Susan, is there one quick thing that you want to say to people?
Allies are really,
that's
okay. I just want to say becoming an ally is so important. Our LGBTQIA community faces discrimination all the time. It leads to poor mental health and suicide. Please remember that as you're looking to use your voice as power, stand up for equal rights and fair treatment of people who are different from you.
Thank you. Robin.
I'm going to reiterate what Jess said earlier, which is, especially if it's your child, it's that child's journey, and they'll fill you in and tell you it day to day what you need to know. It's not your journey. And so if you're confused, you're shocked, you're whatever you are, just remember, love your child.
Jess.
I would say be a safe space, and that allyship is a verb, not an adjective. So you don't get to wake up and say, I'm an ally now. It's an active, something you need to wake up and do every single day. Love your child, love the people around you. And I also want to pitch Seacoast Outright has youth groups for LGBTQ+ kiddos. And we also have a parent support group. So if you ever need support, feel free to reach out and I will throw my email in the chat.
Perfect. Thank you. Kathy.
I love that, Jessica, about the verb. That's great. I would like to piggyback on the group, support group, therapy, whatever, especially in light of the lack of resources for one-on-one therapy, across the country now. It's really hard to get appointments to meet with people. But I would say obviously for the people in the LGBTQ community, support, that's great, but also allies. For me personally, a group therapy group, it was really just group support. It was a bunch of us parents and partners of transitioning people, whether they were children or people's spouses or whatever, got together and talked about it. And it made a huge difference, knowing that you're not alone, that you can ask all those questions that you can't ask the other people because it might be inappropriate. We were all learning together, supporting each other. It was just really nice to know that you weren't doing it by yourself. There's just tons of resources and support out there for everybody, whether you're a part of this community or an ally, and just, find it and we'll all help you.
Thank you so much. Bobby.
Boy, talking about pressure. I would just say lead with love. We're sensing a theme here, and it really is that simple in many ways. Jace had said earlier, listen to, I'm gonna get it wrong, listen to understand, not to, what was it, Jace? If that's like, I'm gonna make a bumper sticker tomorrow.
Listen to understand, not just to respond.
Yeah, it's fantastic.
That one, and ally is a verb. That's another bumper sticker, right? Emmett.
Yeah, I would just say, I want to thank Jace for putting this together, as well as Michelle. Thank you so much. This has been really wonderful. And I've seen that Jace has been putting all these awesome resources in the chat, and I would seriously recommend to check them all out, because they're just vast, and the information is out there, and you can just absorb it all. And I would also say, to support the LGBT community is like Jessica said, is an action. So it's in the media you consume, it's in what's on your Instagram feed, and the posts you like on the internet, because the algorithm follows us everywhere. And it's in the businesses you support, like local queer businesses, and it's in the organizations that are providing care, right? So places like Core Physicians, places like Seacoast Outright are providing these support groups to folks, as well as Dartmouth Health that's providing medical care. So it's like a big conglomerate of these different aspects that are all coming together to support this community. So there's a ton of resources out there, so definitely keep looking through those, and I'm happy to I'll send Jace a few other extra ones that I know could be helpful.
That's great. And I know Jace said you would wait, but go ahead, you can have the last word.
Oh, me? Okay.
Yes, yes.
I am just going to say that connection saves lives. Connection is something that we as humans are always seeking out. And oftentimes coming out as a member of the LGBTQIA+ community can be really daunting because we fear losing those connections. So the more you make yourself known as someone who is going to remain, and someone who can still provide those connections and have that understanding for who you are as an individual, that means a whole heck of a lot to so many of us. So thank you again to everyone who participated on our panel today, and thank you to everyone who came and listened to us and is going to help spread the good word.
Thank you all. Have a great afternoon, and thank you again, you panelists. You're amazing.
So with that, feel free to hop off. And Michelle, will you be able to grab all of the chats and Q&As afterwards?
I hope so.
Okay.
I will stay on and try to do that. Yep.
Wonderful. Well,
Okay.
Thank you everyone so much.